Hello everyone, and welcome to the second part of varicose vein. Where in the first part we have seen how the anatomy of varicose vein helps in sending the blood back to the central circulatory system, and also we have seen that what are the factors which are associated with development of varicose vein. Now we are left with the investigation part and the management of varicose vein. The investigations which will help in diagnosis of varicose vein, no doubt the clinical symptoms and the physical examination done stands out to be the most important part in diagnosis of varicose vein. But still, in order to assess the parts or the segment of venous system involved, the extent of the disease, we have a number of tests. The first one is venography, other is venous Doppler. Third is trindelberg test, tourniquet test, cough impulse test, and perth test. Tourniquet test, what we do is we tie three tourniquets, first at the thigh, second at the knee, below the knee, and third above the knee. Now the patient is asked to stand, and now the appearance of varicosity is looked for within 30 seconds in each segment. So, if the vein above the tourniquets fills up, it indicates incompetency of communicating vein above the tourniquet. So, this is how um, the tourniquet test is done. If the veins below the tourniquet fill up rapidly, it indicates communicating vein below the tourniquets are incompetent. So, these are the inferences. And we have tied three tourniquets. The positions of these three tourniquets are like band-like structures. They are used to compress the veins. Second is below the knee, and the third would be above the knee. With these three, by trying these tourniquets, we have made segments in the leg. Now, after tying this tourniquet, we will ask the patient to stand and we'll look for the varicosities, depending on which area compartment fills earlier. We call it as the particular segment gets incompetent. Okay. We also have this Trindelberg test. And how do we perform this test? It's like a physical examination of the person. Trindelberg test is actually the physical examination. What we do in this is we ask the patient to be in the supine position. Now the leg is flexed. The leg that we want to examine is flexed at the hip and raised above the heart. The vein will empty due to gravity and with assistance of the examiner's hand squeezing the blood towards the heart. So what you have to do, you have to raise the leg above the heart, and then the examiner, that is we the physician or the person who is examining, will compress the legs and try to push the blood towards the heart. Now what we'll do is we'll tie a tourniquet around the upper thigh to compress the superficial vein, but not too tight as to occlude the deeper vein. The leg is then lowered by asking the patient to stand. Normally, the superficial venous vein will fill from below within 30 to 35 seconds as the blood from the capillary bed reaches the vein. If the superficial vein fill more rapidly with the tourniquet in place, there is a valvular incompetency below the level of tourniquet. After 20 seconds, if there has been no rapid filling, the tourniquet is released. If there is a sudden filling at this point, that is after the release of the tourniquet, it indicates that the deep and communicating veins are competent, but superficial veins are incompetent. Now, what we'll do is this test is reported in two parts: the initial standing up of the patient, and in the second phase, once the tourniquet is removed, that is, once with the tight tourniquet and once the release tourniquet. Now, you can repeat these tests at different locations. Now, we have cough impulse test. Patient is asked to elevate the limb, and the patient is asked to cough forcibly. The impulse is felt on the long saphenous vein. This indicates the incompetency of saphenofemoral vein. So for this, you need it's a sort of a physical examination. Then what you do is you keep your hand at the saphenous vein, and then you ask the patient to cough. Then in case the patient cough gives an impulse at the saphenous vein, then it's a positive test that the person is suffering from incompetency of saphenofemoral valve. Then comes the perth test. A tourniquet is tied around the upper thigh. The patient is asked to walk. If the veins get dilated, it indicates the presence of incompetence. Now, regarding its management, the very first management is an external pressure used by wearing stockings, which are elastic crepe bandages. It's like a socks, longer socks, which will come till your knees, but they are comparatively much tighter, as that gives a compression and it will force the blood to move in the upward direction. Second is elevation of limbs. The patient is advised not to stand for too long or keep their legs hanging for too long. Also, elevation of limbs during the resting position also helps in lowering the symptoms. Then we have graded compression, as we can see how the difference in the pressure has been graded. That is, the largest compression would be at the medial malleolus or the malleolar region or the ankle joint. Exercising was also suggested that walking will definitely help in relieving or sending the blood back. Avoidance of prolonged standing is a conservative technique. Also, we have compression method that reduces ambulatory venous pressure. It also improves cutaneous microcirculation. Some therapies, that is sclerotherapy, is also used. Injection of sclerosant, that is an ethanolamine oleate into the varicose vein, causes sclerosis, leading to complete obliteration of the valve vein. Surgical management is also used, but sometimes it's contradicted in cases of DVT, pregnancy, and peripheral vascular diseases, thrombophlebitis. That was all. the management will see in the classes of surgery. It was all about in the varicose vein. Thank you.